Good afternoon, everybody. I am Archana, Lactation Consultant. So today I am going to speak about antenatal breastfeeding preparation, which will help in enhancing both maternal and neonatal outcomes. So what are the learning objectives for today? So our learning objectives are understanding the importance of antenatal breastfeeding counseling, and we also discuss the strategies how to prepare mothers for breastfeeding, highlight the role of healthcare providers in ensuring the breastfeeding success. So first we will talk about some global breastfeeding goals. So both UNICEF and WHO recommends early initiation of breastfeeding, that is breastfeeding within 1 hour of birth, that is also called as golden hour of feeding, exclusive breastfeeding for first 6 months, then continued breastfeeding along with complementary foods up to 2 years and beyond. So these are the global recommendations for breastfeeding, and WHO aims to increase exclusive breastfeeding rates at least by 50% by year 2025. This is the global aim of WHO to increase the exclusive breastfeeding rates. So what is and it plays a very important role in prevention of malnutrition and infection, and reduce of neonatal mortality under 5 mortality rates also. So that is why there is a huge what you called as recommendation by both WHO and UNICEF also. Now coming to benefits of breastfeeding. What are the major benefits in like a clinical perspective? If you see what are the major benefits, what a baby is going to get and what a mother is going to get is mainly immunological benefits. And it reduces in NEC, sepsis, allergies. It helps babies to grow nutritionally very well, and it is also natural components which present in breast milk is not present in any other supplementation, and long term metabolic health is provided by breastfeeding, and it is also helps in low risk of obesity, type 2 diabetes, and also it will also help in cognitive abilities of the baby. It will help in enhancement of the brain development. It will also give more IQ levels to the baby. So these are some things for baby, and there are very good benefits for the mother also, like there is decreased risk of postpartum hemorrhage, and there are long term benefits for mother like reduced risk of osteoporosis and breast and ovarian cancers. And also there are different advantages to mother, like their mother's weight loss. The journey of weight loss is also easy if the mother is exclusively breastfeeding. So these are the different benefits of breastfeeding exclusively. Then what are the challenges we face in initiation of breastfeeding? Because this is the first step where we start after a after a neonate is born, and we are going to initiate breastfeeding, and if this step is success, then the work is half done. So what are the challenges what generally healthcare providers face to start breastfeeding initiation, or we call as early initiation? First is maternal factors like lack of knowledge or confidence. Mother doesn't know about this, and then there are some medical conditions like mother is having diabetes, so monitoring the baby is very important, and obesity, breast surgeries. There are different conditions why there can be challenges in initiation of breastfeeding. And there are neonatal factors like prematurity of birth, low birth weight, or baby has taken for NICU admission for any meconium strain like her, or any other factors like RD or TTNB. All these factors comes where the mother and baby are separated. And there are some anatomical issues like if the baby has born with any metabolic disorder or anything, or any tongue tie or something, or any congenital malformations also we can take it into consideration. Systemic barriers. What are the systemic barriers? Lack of institutional support or limited access to skilled supportive care, and also sometimes we can also like lack of cultural issues, family support. Like for example, immediately after delivery, the baby is expected to be shown to the parents or the grandparents who are waiting outside the labor ward or the OT than initiating breastfeeding. These are some issues like what some barriers with breastfeeding. And sometimes in the OT, general anesthesia is given to the mother. That is also one of the consideration, because of, again, that comes under maternal factors. Because of some issues with the mother, general anesthesia is given for the LACS. During that time also there is definitely separation between mother and baby. So what is antenatal counseling? What are the key goals? What we should look for when we are starting antenatal counseling? First is education to the expectant mothers. What all we have to teach to the mothers, making sure that she is breastfeeding successfully. First is mainly we have to talk about importance and benefits of breastfeeding physiology and techniques, early challenges and their solutions. And we also have to build the confidence of the mother, and it reduces her anxiety, establish the trust and a supportive environment. So these are the core goals what we should look for when we start antenatal counseling. And according to BFHR, they should baby friendly hospital initiative. There should be mothers who are delivering, if it in an institute, 80% of the mothers should at least attend antenatal counseling regarding breastfeeding. So that can be done by their gynecologist, their neonatologist, or any lactation support staff who are present in the hospital. So it gives a lot of confidence to the mother, because most of the family members will not talk, and nobody, like friends or family, doesn't give any information about breastfeeding to the pregnant or expectant woman. So it is always better that we in healthcare setting offer her uh, like a small talk about breastfeeding, or you can also offer give a personalized one-on-one session also with a pregnant mother. So what all mothers needs to know? First, main important thing is that how the milk production is happening. She should be knowing about the hormonal regulation of the milk production. Like first is prolactin and oxytocin, how they both work in sync, and how the stages of lactation will work. Like when is colostrum coming, and transitional milk, mature milk, and all, and how is milk demand and supply principle work. And we should also talk about early initiation of breastfeeding, and we should talk about the latching and positioning of the baby, how the baby is to be latched and positioned depending upon the mode of delivery. If the mother is going with normal delivery, what should we do? And if the mother is going with cesarean section, what are the pros and cons of initiation of breastfeeding? All these things to be discussed during the antenatal counseling of breastfeeding. Now, and second important thing what we have to do is that also is antenatal breast examination. What is the purpose of antenatal breast? It is to identify any physical barriers to breastfeeding. For example, if the mother is having any flat nipple or inverted nipple, it is better that we inform the mother before. And also we will come to know any surgery or any abscess. If it is a multipara mother, then we will come to know about any surgery or any history about breastfeeding, how she has fed her first baby. All these things will give us lot of information about the mother's confidence levels, and the fears of the mothers can be addressed. And also any signs of infections, or if she had any lumps or abnormalities during her preconception time, all these things we will come to know during the physical examination of the breast. So when we are doing physical examination, we should always talk to her about nipple size and shape, breast surgery history, and also any signs of any infections or any lumps or any abnormalities, and informing her what are the pros and cons because of the problems what she is having, so that we can develop her confidence levels, and also how we are going to support her post delivery is also very very important. For suppose if there is any issue and that needs a specialist care, it is always better to refer to a specialist like breast surgeon or a lactation consultant. What are the practical strategies which we need to apply for the antenatal counseling here? First is offering an antenatal classes. As I have already mentioned, 80% of the mothers who are delivering in an institute should attend at least one antenatal session before delivery. So if that is happening before 34, in between 34 to 36 weeks would be very very beneficial. So interactive sessions on breastfeeding techniques and common challenges plays a very very important role. And developing personalized plans, as we can take a class on or we can take a session on the breastfeeding techniques and common challenges on the whole, like it can be like a group session kind of thing. But there should be, if there is any mother who is having any issues on her breast, and if she identifies that she's having an inverted nipple, or she was not able to breastfeed her first baby due to some or the other reasons, it is better to have a one-on-one discussion with that mother or with that pregnant woman and family, and have a tailor based counseling for those parents. And also it is better to get their complete medical history, and also their personal concerns should be addressed. And you should also prepare them for early skin to skin contact. This will help in initiation of breastfeeding and also bonding. What is the role of family? So as we healthcare workers, we talk to them, we counsel them regarding breastfeeding and all, but ultimately the support of the partner and family members also plays a very very important role. So here for an antenatal counseling session, it is better that a mother attends along with her partner and family members, like a mother or a mother-in-law who is going to stay with her, or or a sister who is going to stay with her and support her during her early postpartum stage, so that they will also understand what needs to be done, and what are the key points what they should note down, and how they should support her in the initial days will be made clear to them. And it also helps in promoting a positive and supporting breastfeeding environment at home. It also, and we can also do provide them some breastfeeding support groups or any some community resources like Facebook groups or Insta handles, so that they will read up themselves and prepare themselves for the following on journey. And what is the institutional support that we expect for breastfeeding to have a smooth breastfeeding journey of a mother is? First is initiating the 10 steps of successful breastfeeding. There are 10 steps of successful breastfeeding which is given by baby friendly hospital initiatives, BFHI. This is a global strategy, you can say. So there are 10 steps where how we are going to, first is the mainly is the hospital policy, how the hospital is promoting the breastfeeding. Does they have a written breastfeeding policy? Does their staff are competent to provide supportive care to the parents? How much antenatal care is provided in regards to breastfeeding to the pregnant woman? And care right after birth, like immediately after birth, if the breastfeeding is initiated and skin to scare is initiated, then support the mothers while breastfeeding, like during the stay in the hospital, that 1 or 2 days post delivery, how much support is provided, round the clock support is available or not. Then supplementation happens only if medically indicated. That plays a very very important role. What are the general medical indications for supplementation are hypoglycemia, low urine output or zero urine output, and zero stools output, and at least in within 48 hours more than 10% weight loss are the general indicators for supplementation indication. And supplementation indications should be explained to the parents also. Proper consent and counseling should be done to the parents before starting giving a infant milk or formula to the babies. And we should also support in rooming in of the baby and mother together. Responsive feeding, that is demand feeding, is what is expected to give a good results in exclusive breastfeeding. And bottles, teats and pacifiers to be avoided. This is the ninth step of BFHI, baby friendly hospital initiatives. And discharge care, providing ongoing lactation support post discharge also it plays a very important role to continue exclusive breastfeeding till 6 months of age. So these are the 10 steps of successful breastfeeding. And an institute which follows these 10 steps will be having good breastfeeding rates compared to the other. Then coming to success monitoring, how we are going to monitor the success. So in neonatal indicators are, first is, as we spoke about, adequate urine outputs and regular weight gain is the neonatal indicators. Maternal indicators are no signs of engorgement or mastitis or pain while feeding are from the mother, and positive feedback from the mother regarding feeding experiences. And how to monitor the success, other kind of success rates are like breastfeeding rates, maintaining data. And also we should be able to understand how why reason for starting supplementation to the babies, how to decrease the supplementation rates. If the getting a hypoglycemia protocol within the unit, like putting a strict cutoff, and also regulating the number of supplemental feeds to the baby, more number of supplemental feeds. If the baby is given more number of supplemental feeds, how to counsel the parents about decreasing the supplemental feeds. And the quantity of the feeds needs to be also regulated if the baby is getting more than what is required. And here the conclusion is, always breastfeeding is a public health priority. Like it is because if exclusively breastfed babies have more IQ and good health, so we are going to have a healthy generation in future ahead. Antenatal preparation plays a very critical role in successful breastfeeding initiation. Always remembering what points we have spoken about the in the antenatal period, the mother will have lot of benefits because of that, because she will remember what all the points we have spoke, and she will try to implement. If at all she is not able to deliver in your in the same institute also, she will be remembering these points, and that baby will be successfully breastfed because of successful early initiation. And healthcare providers plays a very important role in empowering mothers and addressing the challenges, because the first 3 days immediately after birth, 2 to 3 days, the mother is going to stay with healthcare providers under the supervision of healthcare providers. So providing the mother powerful information, and also providing them with supportive care with evidence based information plays a very important role. So this will help the mother to successfully breastfeed and get a ample family support. So it is everybody's duty. It is not just like it is not the lactation counselor, lactation consultant, or a neonatologist duty to only to continue breastfeeding. It plays a it is for everybody's duty. So we play our role is very important. Thank you.